So in this video, we want to talk more about the treatment of ischemic heart disease. In the last one, we kind of looked at some of the identifications, some of the ways that that's determined, especially in cardiac stress testing. But now we want to talk about how that's treated. And keep remembering the supply versus demand aspects of this. A lot of times, some of the medical management when someone has angina is to increase oxygen supply by giving a vasodilator. So nitrates, nitrogen donors that increase the production of nitric oxide, sodium nitroprusside, nitride, nitroglycerin. Oral, oftentimes you can stick those underneath the tongue. They're a profound vasodilator, and that'll increase oxygen supply. Oftentimes it produces lightheadedness, so someone will lay down, and that also happens to diminish the oxygen demands of the heart as well. Beta blockers diminish the heart's ability to increase in rate and contractility. Again, getting on that demand side. Calcium channel agonists. We've talked about calcium channel blockers. This is the opposite of that. Agonists not as used as commonly as any of the others. Probably the most common now are the statins. Anything that lowers the production of cholesterol, especially the LDLs, not only used for prevention, but also part of the treatment to prevent either restenosis or progressive atherosclerosis. And then what we like to deal with a lot is all of the ways you can modify your lifestyle, diet, and physical activity primarily to diminish the risk for cardiovascular disease. So there's two common surgical interventions that are done for treatment of cardiovascular disease. The first very desirable, relatively long-term way of treating cardiovascular disease is with coronary artery bypass grafting, so-called CABG. And in a CABG, they actually will, if let's say there's an occluded blood vessel here on the heart, so we have the left coronary artery coming down, and let's say this is the LAD, and that's partially occluded. What you can do is go around the spot that's occluded. You can bypass that, and they're showing two of those on here. One of the ways you can do that is you can pull down the mammary artery from supplying the breast tissue, pull that down, and tie it into the coronary artery downstream of the occlusion, and so you can restore blood flow downstream. These other two areas are also showing where you can take a vein out of the leg, and you can again tap that vein into the aorta and go around areas that have occlusion. And again, that's bypassing or bypass surgery to bypass the area that's occluded. So in this instance, there are three grafts that are bypassing areas. So this would be a three-way bypass, and you guys have heard one-way, two-way. I've heard all the way up to a nine-way bypass, different occluded areas on the heart. The other surgical intervention is called percutaneous transluminal coronary angioplasty, oftentimes just referred to as angioplasty for short. Sometimes as part of that angioplasty, they will insert a stent or a balloon to help alleviate the occlusion. In angioplasty, you don't have to open up the chest. They'll oftentimes, they'll usually go up through the femoral artery in the leg. They'll thread that femoral artery up through the aorta and then into the occluded area. And then oftentimes what they'll do is, not shown perfectly well here, but the area that's occluded, they'll slide the angioplasty into the occluded area, inflate a balloon to open that, and then once that area is open, obviously the blood flow is restored. The difficulty is in keeping that open. So oftentimes what they will do is they'll implant a stent. So here, after the balloon has opened up the area, it's supposed to be fatty plaque, including the walls of the artery. The balloon is inflated, and around the balloon is what's referred to as a stent. And the stent will hold that blood vessel open after the balloon has been removed, and so blood can flow through there. Fairly good in terms of rapidly restoring blood flow. These restenos fairly readily, simply because you're impairing the endothelium in that area. Straight stents come in all different sizes, even what are referred to as bent stents, in order to match the area. So that's percutaneous transluminal coronary angioplasty, or just angioplasty for short. Also, if you do have, they're showing a couple areas here where they have a blood clot that's occluding a blood vessel. They can do the same kind of thing, but if you have a clot, just like we mentioned for stroke, you can administer things like urokinase or streptokinase that will help to dissolve that clot, or in some cases, actually will go up there and remove it. In this case, they've threaded this up into the artery, and they've removed that clot that's allowed blood flow to be restored to the heart. This is the similar kinds of things that you would see in an ischemic stroke to the brain. And then there's a variety of different both medications and lifestyle modification to prevent that narrowing of blood flow from occurring again, or restenosis. We mentioned a lot of these, a lot of the things that prevent clots, like aspirin, which is also an anti-inflammatory, as well as a blood thinner, heparin, warfarin, Coumadin, the nitric oxide donors, like sodium nitroprusside, given chronically, all the way down to some of the other things that we've talked about. Please note that the antioxidants are listed here. The dietary ones are listed. Don't forget about the endogenous antioxidants as well. And then in the future, the hope is through physical activity, better diet, lack of obesity, less salt in the diet, you wouldn't have to deal with this, but we know that's probably not likely. There's some interesting things. Some of you are familiar with the vascular endothelial-derived growth factors, or basic fibroblast growth factors that help to sprout new blood vessels. Those have had some success in diabetic patients, but basically what they do is they take microspheres that are sized for the area that's occluded within a blood vessel, and then instead of trying to open up that area, they transfect the area with the messenger RNA, in other words, provide the genetic material to increase production of these vascular growth factors to sprout new blood vessels, which would be a very, very desirable way. If we go back to some of these pictures where there's an occlusion there, if you could sprout new blood vessels in that area, that would be desirable, which is exactly what physical activity or doing cardio does for your heart as well. So good, so make sure you get both parts of this, what the pathology is for coronary artery disease or ischemic heart disease, same thing, and then how that can be treated both surgically and with medication and lifestyle modification. We're gonna focus on more on that later on. All right, good.